Morning, everybody. I'm going to say a little bit about population health and wellbeing. I could spend all day talking about population health and wellbeing, so what I've tried to do is to distill out some of the key headlines. One of the challenges with population health and wellbeing, particularly at a Northern Ireland level, at a local level, is that there are so many sources of information and not a sophisticated enough system to bring all of that together to create concise, targeted information. So there's a lot of cobbling together to be done in terms of compiling the information and then understanding it. So as I say, what I've tried to do is to pull out some of the key points as they pertain to particularly the workplace health and wellbeing in this area. So, just in population terms, I thought that this was an interesting point to note that over the next, by 2028, the prediction in population growth is that there will have been a decrease in the number of 0 to 15-year-olds in this area. A slight increase in those of working age, in other words, age between 16 to 64. What's really telling here is the significant increase in the number of people aged 65 plus. 31% increase between 2018 and 2028. And I think from a workplace health and wellbeing point of view, that's interesting, not the least of which is because of the impact in the workplace and also the impact on employers. Whilst if the population is aging, the workforce is aging, but also I think from the point of view of workplaces as social partners in community health and wellbeing. And I think it's important to understand that our population is aging, and there are many, many benefits to an ageing population. Increased life expectancy, obviously, shared experience and knowledge, the economic benefits, talk about the grey pound, increased voluntary work, provision of childcare. We know that many people aged 65 plus, particularly those that are heading into the retirement bracket, provide childcare for their families. There's a greater concern for the environment in the older population, generally speaking, and a focus on community well-being. Some of the concerns for an ageing population: health and social care provision. Obviously, as people grow older, the likelihood of developing longer-term conditions is greater, and there is a significant impact on the provision of and cost of health and social care. In relation to that, pensions, housing, there are all sorts of concerns. My own personal view is that the benefits outweigh the concerns, but we can't ignore the concerns either. And again, I think from a workplace health and wellbeing point of view, it's important to grasp the fact that our population is aging and will continue to do so, and we'll continue to see that growth in the coming years. Coming back to a more general kind of population health statistical sort of area or arena, you'll see here this information is lifted from the Northern Ireland Health and Wellbeing Survey from a couple of years ago. They published on the Department of Health website. And I just wanted to pick out a few headlines here, again, in relation to health behaviour. Now, health behaviour is only one aspect of population health and wellbeing, and the reasons behind health behaviour are multifaceted, often complicated, and not down to any one single thing. Environment, education, housing, social status, economy, all of these things impact on the health of the population. All of these things impact on the behaviours that people choose or may feel have limited choices over in terms of their long-term health and well-being. But there are some positives here, and I'm not going to read through all of these. But if you look, for example, in the top left-hand corner there, in 2019, 17% of adults smoked cigarettes. This is on a Northern Ireland-wide basis. That's down from 24% in 2010 and 11. That's a reasonably significant drop over that period of time, and it's encouraging, particularly for somebody like me, who works in health and social care, who has a passion for early intervention and prevention, to see that sort of a fairly dramatic change over a reasonably short period of time. There are other stats there in relation to BMI. These are some of the big hitters in terms of health behaviour. These are the things that we know, if we can support people to make positive changes, we can actually make significant long-term population health and well-being outcomes over the longer term. BMI, physical activity, smoking behaviour, use of alcohol and drugs. These are the things that if we can influence how people think and how people behave, we can actually make some significant long-term changes. There are other aspects to population health and well-being that are not merely about health behaviour. And this goes back to the point about an ageing society as well. Loneliness is a significant challenge now from a health and social, or from a population health and well-being point of view. Not exclusive, I must say, now to the older population, although it is a factor. People can be lonely at any stage in life, and we are seeing that it is having a significant impact on long-term health and well-being, with particular reference to mental and emotional well-being, and all of the things that we know come from that. And there you see, in terms of sources of stress, a range of different sources of stress, including those that are workplace related. And again, I think it's important to reflect on how the workplace can actually serve to improve people's mental health and emotional well-being, and be a source of support where that's needed. Very briefly, I wanted to pull out some of the health inequalities. I appreciate that the contrast on this slide probably isn't brilliant, so I'll pick out a few things. We know that, again, for reasons related to socioeconomic factors, education, geography, ethnicity, disability, sexuality and sexual orientation, there are many, many factors that impact on the access to and experience of health and social care and health and well-being that people experience. And some people and cohorts of the population, unfortunately, don't experience in as positive a way, or have access, or feel that they have access in the same way that others do. And that's obviously experienced, or it's described as health inequalities, where there are poorer outcomes in certain cohorts of the population than there are in others. And you'll see, for example, there at the top middle, the alcohol-specific mortality in the most deprived areas is 4 times of that in the least deprived. In terms of smoking during pregnancy, in the most deprived areas, almost 5 times that in the least deprived areas. And again, there are many, many reasons behind this. I think from a workplace health and well-being point of view, particularly at a local level, there's, you're kind of strategically placed and actually in a unique position to be able to support people and understand what some of these challenges are, and to work in partnership with others to try to find ways to deal with those issues. Sorry, just to highlight, and I appreciate I'm probably running over my time here. COVID-19, again, it's already been said, I'm not going to go into detail about it. What COVID-19 has done, or one of the things that it has done, is to exacerbate the inequalities in health that people experience across society. So it has been worsened for many, many people. The issues around access to services, the issues around understanding health messaging, have all been impacted by COVID. The loneliness, the mental health and well-being, etc. And this is something that, as I say, it's already been said, we need to give long-term consideration to in terms of how we can work collectively to try to support people who have been particularly impacted by COVID and who of us haven't over the next 10, 15, 20 years. However, a bit like David earlier, I don't want to focus too much on the negative. There are positive things that we can do, and I mean, I could cite, some of the regional strategies, the regional public health strategy, for example, Making Life Better, the government position paper on health and wellbeing 2026, which is essentially setting targets for improved community health and wellbeing, programme for government itself. All of these things, including the mental health strategy, which, as David said, has recently been published, point to a real desire at a regional level to try to address some of the most challenging aspects of health and social wellbeing. There are things that we can do locally as well, personally, and in our workplaces and in our local communities. They're very simple. They're simple in concept. Some of this can be difficult for people to grasp, difficult for people to actually commit to. As a smoker of 30 years, 20 cigarettes a day, it's an easy thing for me to say there's support out there to help you quit, but I know how challenging that can be. Similarly with physical activity, and looking at ways in which to improve our mental health and well-being. But the easier that we can make these opportunities for people, the more accessible we can make them, the more common and everyday the language is, then we're in a much, much better position collectively to improve outcomes for the whole population over the longer term. And I wouldn't be a health and social care professional, by the way, before I got off this stage, without giving you a little flavour of how COVID infection is currently within the district. And without getting into the detail too much here, you'll see that on the right-hand side of that chart, community infection rates are on the increase. This is specific to Newry and Morningtown, but generally speaking across Northern Ireland, we are seeing that level of increase. And to advise and encourage you to take up the vaccine, because we know that coupled with the social distancing, the hand washing, all the very, very simple things, these are the things that can really, really make a difference in terms of being able to to go forward positively and to be able to focus on the long-term population health and well-being for the whole of the district. So, thank you.